We're here at TEDMED 2012, and a theme of TEDMED in general is innovation. What are the new ideas in health and medicine? So let's start with the Cleveland Clinic. What are you doing in innovation? You're really seen as a leader nationwide, but can you give us an example of what you actually do in that space?
Well, we appreciate that. Our 9 decades really have been marked by a lot of innovation, whether it's in cardiac care or face transplant. But you know, we take that concept of contribution and really try to stimulate creative thought in almost everything we do. We call it the virtuous cycle. How do you identify those problems, come up with solutions, and then gestate them through a series of capabilities so they then can return and extend and improve patient lives. So we really take innovation as a cultural norm, cultural imperative almost, and we want to have an ecosystem that allows our creative people to thrive, have them solve those problems we need to solve as an individual, an institution, and frankly as a country.
We work at the individual level, so what we work on is helping people achieve their goals in their life, whether it's to find financial independence, lose some weight, eat a more healthy meal more regularly, or spend more time with their family. We help people break those goals down into individual tasks that they can do every day. We call them feats. And we use technology to trigger people to help them realize that they can do these things really simply right away in their daily life. And then we build rewards and other incentives into the process to help them find the right way to incorporate an action and turn it into a habit. So we're a big use of technology, and especially pervasive technology. Your phone is very powerful for behavior change, and we rely a lot on that to help you lead a better and healthier life.
So you really focus on positive incentives in the change. How are you looking at positive incentives in the medical care setting?
We want to bring to market things that have a very high potential for the outcome we want, which is extending and improving patient lives. So we have we believe our process is a big part of that. So we have invited the marketplace in. Cleveland Clinic Innovations essentially translates the Cleveland Clinic to the marketplace. So we have really had a nice synergy that allows us to get much more focused and really sharpen our capability to come through with things that will help people like Vinay and his followers.
Well, let's get to some specifics on both innovations and sort of breakthroughs, but then some failures. What have you seen at the Cleveland Clinic that's really worked, and what's just failed?
We were one of the first adopters of the electronic medical record in the early 2000s, 2002, and we found out how to gather data, but then we now, I think, are at that inflection point where we understand the importance and the impact of having a conversation with that data. So if anything, we are probably going to be most prolific in our next phase at healthcare information technologies that allow the physician, the patient to optimize their interaction. It will go down and help the patient at a direct level, and I'd like to hear what Vinay has to say about that. And so I think that is one of the great successes. When you're an early adopter, you're first in the pool on something as important as the electronic medical record, you now get to that level of maturity on what that next level of improvement is going to be that's really going to make positive change.
We've been spending 1.5 years trying new things every single day and tracking everything that happens, and we like to see this happen more in the medical field. It has to be put out there, tracked, analyzed, and then iterated on. And the more that you can do that, you can find what works. With technology nowadays, we can't predict how people are going to incorporate it into their lives. You can just come up with an hypothesis and then test it. Test it over and over again.
So I want to talk about optimism and pessimism. We're here at TEDMED, and we're looking at the future, and I'd like to know from each of you, are you optimistic or pessimistic about America's health and healthcare? Dr. Graham.
Of course I'm an optimist. I mean, I think, you know, we have the greatest medical infrastructure in the world. We just do. And we have so many bright people. If we can continue to attract young minds to medicine, I think that is one of the challenges with which I am concerned. And can we have people still realize that it is an important place to put your money, to have investors say, I'm willing to take a chance, because there is no commodity like healthcare.
Yeah.
And it's a tough business. Just think, nobody wants to be sick or injured. They don't want your product. So
or die.
Indeed. And so we have to bring capabilities and the type of possibilities that only that type of collaboration will bring.
Vinay, optimist or pessimist?
Definitely an optimist. And to carry on what Dr. Graham was talking about around young minds in this area, I think we spend too much time sending kids out to build the next Facebook. we can direct that great innovation and thought power that they have using technology and how to combine that with getting people to engage and redirect it into healthcare. And we're starting to see that more. And it's such an interesting area. There's big data, there are big problems, it's meaningful change. You can make change happen relatively quickly, and there's money in the area too. It's ripe for innovation. It's going to be awesome. I can't wait to see what happens in the next 10 years.
Well, I want to thank you both for being innovative, both for caring about our health, for being here and for talking to us. Really appreciate it. Thanks.
I appreciate it.
Thank you. Take care.
Thank you.
Take care.